How fancy your bookshelves are looking.
Oh, no. I think we're on Facebook Live though, so we're not, we shouldn't talk about my bookshelf. Hello, everybody. This is Dr. Jennifer Gardella. Kim does not know this, but I've titled this BCHIP Talks Turkey about healthcare. Pretty clever, right?
Love
Uh,
it.
Given that we are coming up here on Thanksgiving. So, welcome to our fearless leader, Kim Everett, to the biweekly Zoom call to share what's going on in the healthcare world in Bucks County. How are you today, Kim?
Good. Thank you, Dr. Gardella. Always good to spend some time with you today. I appreciate it.
It is.
Happy
We haven't.
Thanksgiving to you and to all that are joining us today. Looking forward to talking turkey.
I mean, really, all we ever do is talk turkey. We don't. There's no fluff here. I don't do fluff. So let's talk about BCHIP a little bit. What's going on? Maybe we could, restate the overarching mission. Not that thing we memorized, but like truly, what does BCHIP do for people in Bucks County?
No, I love that. And that is our mission, and it is memorized, and we're really true and working toward it all the time. So, the mission here at BCHIP is to be addressing gaps in healthcare collaboratively with our 6 hospitals, as well as our community partners and county and the Bucks County Medical Society. So, all of them come together to work together to address gaps in healthcare. And that is what we do every day. So, excited to be able to support that mission.
Yeah, fabulous. And I raised my hand because I always do. But I had the great honor of interviewing the president of St. Luke's last week, and he shared how important BCHIP is to bringing healthcare systems together, the 6 hospitals. And he was kind of funny. He said, Dennis said, we're all technically competitors, but we learned so much through the partnership of BCHIP, and that wouldn't really exist. There's no mechanism besides BCHIP. It's so unique. And he said, I've never heard about it anywhere. So that's a feather in your cap that we've put this together so that they have a sense of community. Because as we all know, CEOs get a little lonely at the top. So it's great that they have you guys to act as that intermediary to share ideas. And, you're the panic button when things like COVID comes around.
Yeah, let's hope we don't have too many more panic buttons. But yeah, and what's nice is, there are other communities that have tried to start this and they just have not been able to do it, and or they've started it and not been able to maintain it. What I find so fascinating about BCHIP, because I was part of BCHIP originally 29 years ago on one of those committees, as I shared with you before, in starting my career here in the community. What I love so much about it is that even though the layout of healthcare in our community has changed so much. So many of them have joined larger health systems. Some of them
Right.
have changed health systems multiple times, at least throughout my career. But what I think speaks so neat to the mission, or so true to the mission, is that even though they have become part of larger health systems, and even though the CEOs have changed in some organizations many times, that once they get engaged with BCHIP and they learn about it, they stay engaged and they stay committed to it. And so I think that really speaks to the uniqueness of the work. And so I do love that about the organization as a whole. I really do.
Yeah, it just brings the groups together. So that's what we need more. We need more of community. We've talked about that before.
Yes, yes. So yes, so that's kind of, that's just a rehash of a little bit about what we're doing here.
Great. So you guys are doing a lot of programs, right? We do smoking cessation. You guys help people with their living wills, all related to uh, taking care of their health. You have the long-term care partnership, taking care of our elderly, and what are we going to do in the future? And then you also homebound immunization program, so that people that are unable to seek medical attention or leave their house can have vaccines administered in their home. You guys are involved in the blue zones in Bucks County. I know we don't have a huge update on that one. We're still waiting for a report, correct?
So yes, so as far as Blue Zones, we did receive the assessment back from Blue
Oh,
Zones, but only for for BCHIP and the Senator's office. So we've had the opportunity to review that. What I can tell you is it's extremely comprehensive, which I didn't expect anything less. I'm very happy about the fact that it was really comprehensive, truly. And I think they did a very good job of identifying what I would also say are the needs in our community. We have met with them just as early as last week. I want to say just last Thursday, so only a few days ago. And we've given our feedback on the assessment and in addition to their proposal. So we're looking for a little more detail, not necessarily in the assessment, but looking for the proposal to align with the assessment and kind of really get some things a little more aligned so that we know exactly what the request for funding is around and what that's going to look like for our community. So of course, they were very receptive to our feedback, and they're going to take the next 30 days or so. And we're hopeful that we'll convene that steering committee that we originally brought together in January and give the assessment and the proposal and talk about what next steps for Blue Zones will be at that time. So stay tuned, everybody, because I know a lot of folks have been reaching out to us about Blue Zones and excited about that work. And we just want to make sure we're very intentional in where we see the direction for that work going in the future.
Yeah, that's great. And there is so much support. I told you I was, reading a simple book on finding your purpose, and they were talking about the Blue Zones. And then there's the Netflix series, and now it's here in Bucks County. So it's kind of converging and sharing in a lot of places. And this idea of community is what keeps coming up. You need friends and family around you at all times, like we will have this weekend for most of us.
Right. Yes,
Yeah.
absolutely.
And speaking of Thanksgiving, BCHIP just got a slew of Walmart grants. Tell us
Yeah.
about those.
So one of our staff members is just doing a beautiful job. So we were notified of some funding changes for one of our grants. And so right now, when we do immunizations in the community, if someone shows up who is under or uninsured, we cover the cost of their vaccine. Now, I always say we don't really advertise that, but here we are advertising it today, right? But it's not, we don't put on our flyer if you're uninsured, come to this clinic, because we don't really have funds for this, if I'm honest. We had a small amount of funds originally that we thought were going to be covered by a grant. And then we found out that the folks funding that grant said, oh, nope, you can't really cover the cost of vaccines. You can cover education, you can cover some other things, but you can't actually cover vaccine fees.
Okay.
And so I looked at the lovely public health program manager I have, and I said, keep doing shots, because I believe in leading with my heart, right, wrong, or indifferent, at least for a little while. I couldn't have done it for, up to $1 million of debt. But I said, I believe that if we're doing the right thing and we are serving the needs of our community, that we will find the funding.
Okay.
And so that's what we're working to do. So Becky identified a few small funds from the Walmart program. And so she's secured, I think, three to $5,000 worth of grants. Don't hold me to that, but I think it's so.
They kept
a
rolling in
thousand,
last week. She was
yeah,
emailing
like
me.
1,000
Yeah.
here, 500 there, another 1,000. Because what's really great about the Walmart program is we can apply for funding from them every quarter, and you can apply for any of the Walmarts in your territory.
Right.
Well, Bucks County is a pretty big territory. So we did receive funding from them. So we are so excited about that, because now we know that we're not going to be losing money on administering vaccines and doing a program that we knew was the best, right? And so, and it allows us that flexibility to keep scheduling clinics and things of that sort, knowing that if someone who's under or uninsured shows up, that we can meet their needs. So, and we're seeking other funds for some of that work too. It's really challenging in the nonprofit world. And Jennifer, I know you know this too, right? It just, I'm on the board of directors for the Bucks County Opportunity Council. I am very supportive of NOVA, Network of Victims Assistance in our community. I'm on the board of directors for the Bucks Monk Collaborative. So I'm involved in a lot of nonprofits in our community, and so many of them are addressing such significant needs in our community. And yet the majority of us are dependent on grants and funds and our for-profit organizations to support our work. And it's really challenging, right? Because that landscape is always changing, and some grants don't want to be renewed every year, or some grants will only fund certain things, and some grants don't want to cover general operating costs. And, you have to have lights and you have to have walls, and, so it's just, as I still feel somewhat new to the nonprofit world, I'm really grateful for the grants that we receive. The Walmart grants are awesome and going to be really supportive, but I'm forever amazed that we need to fund such critical work sometimes by relying on the generosity of others. It's just an interesting concept to me still.
Yeah, it was like this meme that went around a couple years ago and it resurfaces every once in a while, why do we have bake sales to fund education?
Right, okay, exactly.
And
Yeah,
yet, a majority of the budget, defense budget, go whatever, those funny memes that you always see out there where the moms are slinging their cupcakes. But, to educate our kids and the same thing, like you guys are providing critical coordination in our community and also services. Like you just don't, oh, let's get the hospitals together every once in a while to chat. Like you guys are on the front lines of, okay, how are we going to take care of our elderly population? Because, and you were the one that told me, Bucks County is an aging population. Like, what
mhm,
is that really going to look like? Where are we all going to live? Like,
mhm.
that's an issue.
And afford to live in it.
And who's going to take care of us? Because we
Mhm,
don't have enough workers right now. So when you look at those critical issues, and a lot of people say, oh, we're fine for right now, or they say, I'll be fine.
uh-huh,
And so really it's a community. You guys are the ones that say, well, wait a minute, there's a lot more people in this community besides you.
exactly, exactly.
Yeah.
That is
So
exactly
it's,
what we do.
yeah. And a lot of, social services organizations are feeling it too. So
Yes,
got to keep writing. Okay.
yes, yes.
So in the next couple weeks, BCHIP will, keep chugging along, doing its thing.
We
Uh,
will,
and then
yes.
as we come back at the end of in a couple of weeks, as we move into December and then into the new year, there'll be lots of exciting new things out there.
There will. One of the things we're looking forward to, gosh, Samantha is working so hard at making sure we get that calendar out for our smoking cessation classes for 2025. And Colleen is also securing where those events are going to be for advanced care planning in 2025. So we're doing, December is really a planning month for us. Of course, we have our services still available, but even the general community things tend to quiet down a little bit more as people focus on their preparation for the holidays and things. So
Right.
things get a little bit quieter as far as the actual day-to-day stuff. So we spend a lot of December planning and getting ready for 2025. So we're looking forward to doing that.
Yeah, and the phone is probably going to ring off the hook as everybody, has their New Year's resolutions to stop, quit smoke, to not
Amen.
smoke in 2025. And so then, anyone out there who is looking to make that health change in their life should contact BCHIP immediately for the January information.
Yes, yes. And just because you brought that up, I have to share, we have gotten such incredible testimonials lately from the
Oh,
folks that take those classes. In fact, we discussed today how we're going to reach out to you to utilize them so that we can make sure everyone is aware. But boy, it's something that I don't know if I have an appreciation for, not being a smoker myself, but
right.
the people that benefit from that program are so passionate and committed and grateful and talk about what a difference it made in their lives. It just makes me really proud and happy for my team that do such good work to lead it, coordinate it, and teach it. So they do a really good job.
And I'll say, because I've interviewed most of them without judgment. So a lot of people are like, oh, they're going to expect me to go cold turkey and then, I'm going to slip. And let me tell you, this is a group of individuals who are dedicated to you quitting at some point.
Yep.
Right? So there is no judgment walking in the door. And just like many issues that everyone struggles with, nothing is going to be solved in that first 4-week period or however long the class is. Right? So there's, as I like to say, when I teach statistics, repeat offenders come back as many times as you'd like.
Yep.
And if you make small, gradual changes in a habit that may not be that great for you. It's like when I cut down on the number of cookies I eat, like, well, I'm still eating cookies, but like at least I've, decreased the amount. That is the critical piece of the BCHIP's
Mhm.
smoking cessation program. And I didn't really know that and understand that until I really started to talk to the people who are running your programs. And they are so dedicated to
So dedicated.
people quit it, and they all have them, so, or I should say most of them have quit themselves at some point.
Yep.
And so you're not in with someone like Kim and I who's never had to do the
Right.
dirty work, right? You
Right.
are in the trenches with someone who has been there before, and I think that's one of the beautiful parts of the program.
No, I agree. So certainly happy Thanksgiving, happy holidays to everybody. And we'll look forward to giving you an update on all that's to come next year.
Great. Well, thank you very much, Kim. Talk to you soon.
Thanks.
Okay, I'm going to stop the live stream. Hold on. Live stream.